Dr. Bill Adams here, and do we have something special for you today? We have a new show called No Spin Live Australia, and I've got two of my great Australian mates with me. As a matter of fact, I got one in the studio with us, Dr. Tim Papadopoulos. Tim, thanks so much for coming all the way from Sydney.
You're welcome.
One of the top plastic surgeons in Australia, and joining us from the Gold Coast, none other than Craig Layt, another superb plastic surgeon from Australia. So guys, let's get right into it. I saw this one thing come across my desk, a social media post from somewhere, and it said that there was a panel at the Australian ASAPS meeting, and that they asked the panelists if they would place a macrotextured implant in their wife or daughter, and it was a resounding, unanimous no. And I thought that was really strange, Tim, because
we were on the panel.
You and Craig were the stars of the panel, and I was on it too, and I don't remember it that way. So, Craig, help me. Am I imagining things, or is this not accurate?
No, Bill, we had a few beers at some stage, but you weren't imagining anything. Look, the reality is that we discussed it in a little bit more detail than that, and the answer from my point of view would be yes, I would. I mean, I think the problem we get into is that a lot of people get into this one-track mind way of thinking, where it's that we got a problem with ALCL, therefore don't use a textured implant. However, for me, there are some patients who really need a highly cohesive macro-textured implant in order to, for example, drive out the lower pole of the breast or prevent a double bubble, that sort of thing. And if they don't use that, then they're at much higher risk of getting a complication of some kind, having a reoperation, which carries with it its own risks. So, our job as professionals is to weigh up those risks and benefits and advise our patients about it. Now, if it was my wife who needed that to happen, I don't want to have 3 operations and ended up needing some acellular dermis or something. What I'd rather do is say, okay, let's use good technique to minimize the risk of having a problem with ALCL. And as you know, you and I are co-authors on a paper that shows with good technique, you can really minimize those risks. So the answer from me was yes, I would use it in given situations,
Well, as we were up on the stage, Craig, and I asked you, if Toyota had a problem with their cars, in 1 in 4,000, they'd recall those cars if they had faulty brakes. And I know I caught you off guard, but what do you think now?
Well, Tim, I think you're an idiot, and because that's probably one of the worst analogies I've ever been asked. I mean, the reality is that's saying that the implants are faulty, and the implants aren't faulty. A better analogy would be to say, would you let your 18-year-old son drive your new Ferrari? Because it takes a great deal of skill to drive a Ferrari, and he's probably better off driving the beaten up old Ford that you were scabby enough to buy him, Bill and I, contributors to that paper with the 40,000 implants with no ALCL, and that's because most of the guys there knew how to drive a Ferrari. So the bottom line is, drive the Ford if it'll get you where you need to go. But if you need the Ferrari to get where you want to go, then learn how to drive the Ferrari and use it. So
hang on. So you're saying that a macro-textured implant's a Ferrari, and then the other ones are like micro-textured is a Ford? Is that what you're saying? I don't get it.
I am saying that a macro-textured, highly cohesive gel implant, for example, something like a 410, is a Ferrari, in that in some cases it can get you where you need to be where other implants can't, but you've got to have a lot of skill to drive it. Now, I use micro-textured implants, I use smooth ones, I use macro-textured ones. If I've got a simple, easy breast that just needs a bit of volume, I could throw, a safe plastic bag full of silicone in there and you'll get a good result. You got a tuberous breast deformity, you're not going to get there with that device. So I think it's different strokes for different folks. If you've got an easy case, you can do anything with it and you're going to get a good result.
Are you overthinking things, Craig? I mean, we've talked about this before, that genius lies in simplicity. So we're trying to sort of make things a little bit easier. I mean, there were times when people said that anatomical implants gave you the best look. Well, we know from many studies, Frank Lister's for example, that round implants are just as good as the anatomical implants, and no one can really tell.
Well, the problem with that, of course, is that, you know, a lot of the stuff Frank and other guys show in that situation is they're showing an average good case. And that's exactly what I just said. You can do anything in them and you're not going to see anything. You show me a tight tuberous lower pole, a tuberous breast, lower pole, tight lower pole, with a shaped implant at 3 months and a round implant at 3 months, and I'll show you a difference.
Okay, so let me tell you what I do, and you be critique of my practice. So I try and do the Pareto principle, the 80-20 principle. Okay, so 80% of my patients are in that bell curve, and I can use a round textured implant. It's the 5 or 10% on either end where you have a short, stout female whose horizontal width is greater than the vertical, and vice versa for the taller, thinner patient who has a greater vertical height than a horizontal diameter. And in women who have just some slight ptosis, maybe at the IMF fold, and in tuberous breast, that's when I'll use an anatomical implant. What do you think about that?
I think we just agreed completely. I mean, I don't know if you were listening to me at all, but
you didn't actually clarify it as nicely or articulate it as nicely as me. That's the problem.
Hey, Craig, I like the analogy. I think you should change the Ferrari to Aston Martin, though.
Yeah, well, you know, I just didn't want to tell people what I drive.
Thank both you guys for your time, expertise. You know, I think even the American viewers will be interested in this. And if you want to see more of all of this, you can see it on theplasticsurgerychannel.com.